You know, that feeling, maybe that tightness in your chest, or just the background worry about heart health. And then the thought of surgery, well, that can feel pretty overwhelming, right?
Absolutely. It's a major concern for a lot of people.
So today, we're doing a deep dive into something different, an alternative called Enhanced External Counter Pulsation. You might see it written as EECP. It's actually non-surgical, and it's FDA approved. We're going to explore it based on a really insightful conversation we looked at with Dr. Sukhbindar Singh Sibia. He founded the Sibia Medical Centre, and also Mr. Karan Paul, who's an expert on the EECP tech itself and really advocates for it.
Right. Two people deeply involved in making this treatment more accessible.
Exactly. And our sort of mission here is to understand how this thing, EECP, might offer a way to heal hearts without that invasive surgery. Maybe give a bit of hope, for people looking for other options.
Different perspective, yeah.
Our insights are coming straight from that discussion with Dr. Sibia and Mr. Paul. So let's just jump right in. First question, what actually is EECP?
Okay, yeah, the fundamental question. So at its core, EECP is non-invasive. That's really the headline for many people.
No surgery.
No surgery, no hospital stay needed for the procedure itself. What happens is the patient lies down comfortably, and these special air cuffs are wrapped around their legs, like blood pressure cuffs, but bigger.
Okay, on the legs, got it.
Yep. And these cuffs, they inflate and deflate in a really precise rhythm, timed exactly with the person's heartbeat.
Huh. What does that do?
Well, that rhythmic pressure does something pretty amazing. It significantly boosts blood flow to the heart muscle itself during the heart's resting phase. But here's the other part that's fascinating. EECP seems to stimulate the body to grow new tiny blood vessels.
New blood vessels, like around blockages.
Exactly. It's a process called angiogenesis or arteriogenesis, basically new collateral pathways. And over the course of treatment, these can act like natural bypasses around the blocked arteries.
Wow, natural bypasses. That's a powerful idea.
It is. And just to stress, this isn't some fringe idea. It's FDA approved, like you said, and it's supported by major heart associations globally. It's established.
Right. Okay, so the body sort of helps heal itself by creating these new routes. Now, the conversation we reviewed, it also hinted that the benefits might go beyond just, the usual heart stuff like angina or blockages.
Yeah, this is often where people go, oh, really?
Yeah.
Because while it's best known for coronary artery disease for angina, Dr. Sibia, with his, extensive clinical experience, has seen wider effects.
Like what, for instance?
He mentioned seeing improvements in patients who are recovering from strokes, also potential benefits for people with memory problems, and even possibly positive impacts on things like kidney function and some vision issues.
The stroke recovery, memory, that's quite a range.
It is. Mr. Paul used the word holistic, and I think that captures it. The idea is that improving circulation, which is what EECP does fundamentally, doesn't just help the heart. That improved blood flow can ripple outwards, positively affecting other organs. Better flow to the brain, for example, might be linked to those cognitive observations.
That really broadens the picture. Okay, so given this wider potential, who's the ideal candidate? Who stands to gain the most from trying EECP?
Well, the primary group definitely includes patients with those classic symptoms, chest pain, angina, shortness of breath, maybe their heart's pumping power isn't what it should be.
Okay.
But what's also really important is its potential for people who might be considered higher risk for surgery. Think about elderly patients who often have other health issues going on.
Right, makes sense.
Or individuals with diabetes who sometimes face more complications with surgery. Dr. Sibia actually shared that at his center, they've treated patients from their 40s all the way up into their 90s.
Wow, 40s to 90s, that's a huge age range.
It really is, and it shows the applicability.
Yeah.
And maybe the most crucial point is the hope it offers. It can be an option for people who've perhaps been told there's nothing more we can do surgically.
That's incredibly significant, a potential lifeline, as you say. But, okay, if it's this effective, FDA approved, used in other countries, why isn't it more well-known, more accessible? What's the bottleneck?
That's the billion-dollar question, isn't it? And it's a real challenge. Despite the evidence, despite the approvals, general public awareness is, frankly, quite low. As Mr. Paul pointed out, look, this is used in the U.S., it's used across Europe, it's a recognized therapy. The issue, especially in places like India, where Dr. Sibia and Mr. Paul are focused, is bridging that gap, getting the information out there, making it physically and financially accessible.
So what are they doing about it?
They're actively working on it. They're really pushing for EECP to be included in national health programs, which would make a massive difference in affordability.
Okay, that's key.
Absolutely. And they're talking to insurance companies, trying to get them to recognize its value and provide coverage. Plus, they're involved in actually getting more EECP machines out into more clinics, physically expanding its reach, taking concrete steps.
That's really admirable work, tackling it from multiple angles. So for someone listening now, maybe they're facing heart issues, feeling anxious about surgery. What's the main takeaway message you think they should hear?
I think Dr. Sibia put it very directly and reassuringly. He basically said, don't lose hope.
Simple, but powerful.
Very. He said there is an option that is safe, effective, affordable, and doesn't require surgery. That cuts right to the heart of it for someone worried about invasive procedures.
Yeah.
And he also stressed their approach, treating the person, not just the disease. That patient-centered focus.
That matters.
It really does. And for Mr. Paul, his drive comes from seeing the results firsthand, the before and after, the real improvements in people's lives. Their shared goal, ultimately, is making EECP available, like in every clinic, for every patient who could benefit.
Okay, so wrapping things up then, if we boil it all down, what's the central message about EECP we want listeners to take away from our deep dive today?
I think the core message is this. EECP, Enhanced External Counter Pulsation, it's a real, viable, non-surgical option for many heart conditions. And potentially, it offers wider health benefits, too.
Right.
It represents genuine hope and a chance for a better quality of life, particularly for those who are hesitant about surgery or maybe aren't good candidates for it.
Absolutely. Just knowing this alternative exists feels important, especially given the anxiety surgery can cause. And that actually leads to maybe a final thought for you, the listener, to ponder. What other treatments, maybe less conventional, maybe just lesser known, might hold real potential for improving our health? And, how can we become better informed, more proactive in finding out about these different approaches? Definitely something worth thinking about, maybe asking more questions.